Let's delve deeper into reinfection, as it's the most frequent reason people experience gonorrhea again after successful treatment. When your doctor treats you for gonorrhea, the antibiotics work to eliminate the bacteria from your system. However, this medical victory doesn't grant you immunity. You are just as susceptible to contracting gonorrhea again if you are re-exposed to the bacteria. The most common scenario for reinfection involves sexual partners. If you have sex with a partner who has untreated gonorrhea, you can easily get infected again. This is why it's critical that all of your recent sexual partners are also tested and treated for gonorrhea, even if they don't have any symptoms. Abstain from sexual activity until both you and your partners have completed the full course of treatment. Typically, doctors advise waiting at least 7 days after finishing all medications before engaging in sexual activity again. Ensuring all partners are treated remains a cornerstone of preventing reinfection. Sometimes the issue of gonorrhea recurrence stems from the initial treatment itself not being fully effective. This is what we call treatment failure. When treatment fails, it means the antibiotics prescribed did not completely eradicate the bacteria from your body. A primary cause of treatment failure is antibiotic resistance. Bacteria, including the ones that cause gonorrhea, can evolve and develop ways to survive the effects of antibiotics. If you are infected with a strain of gonorrhea that is resistant to the particular antibiotic you were given, that drug simply won't be effective. Another factor that can contribute to treatment not working as expected is not taking the medication exactly as prescribed. If symptoms persist or return shortly after completing treatment and you are certain you haven't been reinfected, it's crucial to see your doctor again. They may need to perform further tests and prescribe a different or more intensive treatment. Recognizing the red flags. Symptoms of recurrent gonorrhea. If gonorrhea does return, you might experience symptoms similar to your initial infection. For men, common signs can include a renewed burning sensation or pain when urinating. You might also notice a new or changed discharge from the penis. For women, the symptoms of recurrent gonorrhea can also mirror a primary infection. These might include an unusual increase or change in vaginal discharge, pain during urination or bleeding between periods. It's important to pay attention to your body and any new or returning discomfort. It's crucial to remember that a recurrent infection can also be asymptomatic. If you've been treated for gonorrhea and you start to notice any of these symptoms again, seek medical attention promptly. Prompt medical attention is key. The doctor's detective work. Diagnosing a return case of gonorrhea. When you go to your doctor with concerns about recurrent gonorrhea, they will need to perform some diagnostic tests to confirm if the infection is indeed present again. The process is generally similar to how an initial gonorrhea infection is diagnosed. Your doctor will start by asking you questions about your symptoms, your sexual history since your last treatment, and whether your previous partners were treated. The most common way to test for gonorrhea involves taking a sample from the potentially infected site. For men, this often means a urine sample. For women, a swab is usually taken from the cervix during a pelvic exam. If you've had oral or anal sex, swabs may also be taken from your throat or rectum. These samples are then sent to a laboratory for analysis. If gonorrhea is confirmed again, your doctor will discuss the next steps, which will likely involve another course of antibiotics.